This medication is commonly used to treat a specific type of cancer called high-risk neuroblastoma. It is a type of drug known as monoclonal antibodies, which work by slowing down or stopping the growth of cancer cells. It is important to take this medication as directed by your doctor to ensure its effectiveness. The dosage and timing of this medication will depend on your specific condition and medical history, so it's best to consult with your healthcare provider for personalized guidance. When using Unituxin Vial, it is typically administered through a slow injection into a vein, as instructed by your doctor. This process usually takes place over a period of 10 to 20 hours, for 4 consecutive days during each treatment cycle. Additionally, other medications may be given alongside dinutuximab to reduce the risk of severe side effects. The specific dosage and treatment schedule will depend on your individual medical condition, body size, and how you respond to the treatment. It is important to follow your doctor's instructions carefully. If you experience nausea, vomiting, diarrhea, dizziness, or lightheadedness while using Unituxin Vial, make sure to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to note that while using this medication, you may experience serious side effects. However, your doctor has prescribed this drug because they believe that the benefits to you outweigh the risk of side effects. Your doctor will carefully monitor you to decrease your risk. Be sure to inform your doctor right away if you experience any serious side effects, such as mental or mood changes, muscle cramps or spasms, difficulty urinating, or signs of kidney problems. If you experience seizures or a severe headache, seek medical help right away. It's also important to note that this medication may lower your ability to fight infections, making you more susceptible to serious infections. Be sure to inform your doctor if you experience any signs of infection, such as a persistent sore throat, fever, chills, or a cough. In rare cases, this medication may cause a serious condition known as capillary leak syndrome, which can sometimes be fatal. If you develop symptoms such as swelling, severe dizziness, extreme tiredness, or severe stomach or abdominal pain, inform your doctor immediately. Rarely, this medication may cause a nerve problem in the eyes. If you experience symptoms such as blurred vision, double vision, drooping upper eyelid, light sensitivity, or widened or unequal pupils, be sure to inform your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you experience any serious side effects, be sure to seek medical advice and report them to the appropriate health authority in your country. Dinutuximab, also known as Unituxin Vial, can have some serious side effects, such as infusion reactions or nerve problems. Because of this, you will receive this medication in a hospital or clinic, where your doctor can monitor you for side effects and provide treatment if necessary. Before each dose, you will also be prescribed medications to decrease the risk of these serious side effects, such as acetaminophen and antihistamines including diphenhydramine. Most people experience nerve pain when receiving this medication, so an opioid pain reliever is usually given before, during, and after each dose to help manage this. If you do experience side effects, your doctor may temporarily stop or slow down your treatment with this medication. They may also adjust other medications to help lessen the side effects. If you develop symptoms such as fever, chills, severe dizziness, swelling of the face/tongue/throat, trouble breathing, itching, rash, numbness, burning, tingling, weakness, or unrelieved pain, be sure to tell your doctor right away. Before starting Unituxin Vial, make sure to inform your doctor if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Also, be sure to inform your doctor about your medical history, especially if you have blood/bleeding problems or kidney problems. Unituxin Vial can increase your risk of getting infections or worsen current infections. Avoid close contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, consult your doctor for more details. Before receiving any immunizations or vaccinations, let your healthcare professional know that you are using Unituxin Vial. Avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To reduce your risk of injury, use caution with sharp objects and avoid activities that may cause physical harm, such as contact sports. This medication may cause dizziness. Avoid alcohol or marijuana, cannabis, as they can intensify this effect. Refrain from driving, using machinery, or engaging in activities that require alertness until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana, cannabis. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, discuss this with your doctor. It is important not to become pregnant while using Unituxin Vial, as it may harm an unborn baby. Use reliable forms of birth control while using this medication and for at least 2 months after the last dose. If you do become pregnant, speak to your doctor immediately about the risks and benefits of continuing this medication. It is uncertain whether this drug passes into breast milk. Due to the potential risk to the infant, it is not recommended to breastfeed while using this drug. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Unituxin Vial, as they could affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. If you or someone has taken too much Unituxin and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Otherwise, you can contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to act quickly in these situations to ensure proper care and treatment. While using Unituxin Vial, it is important to undergo regular lab and medical tests, including blood pressure, complete blood count, and blood mineral levels. It is crucial to attend all scheduled medical and lab appointments. Make sure to consult your doctor for more information on the specific tests and appointments required for your treatment plan. Make sure to take each dose of Unituxin Vial as directed by your doctor. If you happen to miss a dose, be sure to speak with your doctor or pharmacist to create a new dosing schedule. This medication, Unituxin Vial, is typically administered in a hospital or clinic setting and should not be stored at home. It is used to treat children with high-risk neuroblastoma, a type of cancer. The dosage and timing of this medication will be determined by a healthcare professional based on the individual patient's condition and needs. It is important to follow the healthcare professional's instructions carefully and to ask any questions or voice any concerns about the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.